So communication encompasses a huge area, right? We have speech and we have language. So that's kind of how I want you to think about it as we're going through this. For speech, it's the motor movements of your mouth. So for speech, you may have some issues saying some particular sounds like R and L or S. And that's articulation. That would be a concern in the area of speech, articulation. The other domain of language is even more broad than the domain of speech. It encompasses receptive and expressive language. So receptive language being the language that you understand. Expressive language is how you're communicating to other people.
ABA stands for Applied Behavior Analysis, and it's most commonly referred to as ABA therapy. And so what the model does is it's a therapy that focuses on the developmental progression of learning. And then what it does is it uses the principles of behavior analysis like reinforcement to develop and teach those skills for children. The ABCs of behavior, they just stand for what the context and situations are around the behavior. So A stands for antecedent, and an antecedent is what triggers behavior. The B stands for behavior. So B just describes exactly what that behavior looks like. You may say aggression, you may say more specific than that. Well, they're hitting and kicking, they're biting, or maybe if it's self-injury, they're headbanging, right? So it's what does that behavior look like? And then the C stands for consequence. And consequence is what follows the behavior. So when we take the ABCs and we look at them together, we can begin to identify the context surrounding the behavior and why that behavior is occurring.
I mean, all of us learn differently, and a lot of people are visual learners. A lot of people with autism have a language disorder, a true language disorder, or at the least meet that criteria for social communication challenges. So when you're teaching anything, reminding people of structure, sequence of things, using visuals takes out that language and that social communication demand. That's naturally helpful for people with autism because you're taking away that language barrier or that social communication barrier, and it's just right there for them to see.
So a common strategy that we use with individuals with autism is called a first-then or an if-then board. In general, it's a visual strategy, but it can also be a verbal statement that assists the individual in understanding the expectations in that moment. So the if or the first part of this board is always the task or expectation that needs to be completed before the then is provided. The then is always the reinforcer or reward for meeting that expectation. So a simple first then example would be, well, first eat your broccoli and then you can have the chocolate cake.
Sometimes interventions will say that they're evidence-based, which may just be a case study, and it may be completed by the company that came out with that particular intervention. So it's not well researched, it's not peer reviewed. So just be very, very cautious that what interventions you're receiving and seeking out for your child are tried and true, that you know these interventions, are going to work, are going to help your child progress in the area of communication. We know early intervention is so important. So we don't want to waste any of the time on something that might be experimental or brand new, or we don't know if it's going to work. You don't want your child to be that guinea pig. You really want to focus on those best practices.
The way that I help families prioritize interventions to meet their needs is to really do a nice interview that helps families think within themselves of what's important to them. We all have our strengths and weaknesses. We all have things that change our quality of life that may be different than other people's. And so for one family, I always think about shoe tying, like it just does not matter. They're not an outdoorsy family, they're not an athletic family. And so it is just really unimportant for them to have a child who can tie their shoes. To me, that's good self-awareness that a family is able to identify that this is a skill that is sort of expected in our society, but it's not important to us. We can move on. We can focus our time and energy on something else.